Several faith-based leaders have signed a declaration of commitment to comprehensively tackle HIV. The leaders have committed to abide by the national HIV prevention principles and standards within the realm of their teachings. Details from Monica Jones.
Leaders from the Hindu, Christian, Muslim, Rastafarian, and Baha'i faiths have established the Guyana National Faith HIV Coalition, which calls on all leaders to work towards reducing the disease. Addressing the gathering, Acting President Samuel Hines says a reduction in the number of infections will only result from cooperative efforts and partnership.
Partnerships are vital. I am pleased to note that the government's program has established many partnerships, and today we join with the faith-based community in our efforts to strengthen our fight against HIV/AIDS. I am convinced that we will make even further progress.
The leaders say they recognize the impact of HIV-related stigma and discrimination among individuals and will therefore offer guidance to those confronted by difficult choices. They have also committed towards utilizing their facilities to offer support to victims. And Health Minister Dr. Leslie Ramsamy urged the leaders to not only focus on HIV, but the elimination of poverty in an effort to promote healthy lifestyles and the development of the country.
Today we are called upon at this conference to bring our wisdom together, to act in unison, and to act for one thing and one thing alone, to give concrete expression to what God wanted for human beings, all of us, to live with equity, to live decent and dignified life with justice.
Among the gathering at the International Conference Center were 3 internationally renowned religious leaders and scholars from India and Uganda. Monica Jones, the 6 o'clock news.
A taxi driver attached to luxury cabs has been refused bail by the acting chief magistrate after being charged for carnal knowledge. The charge states that on September 6th he had sexual intercourse with an 11-year-old girl. Keith Watson of Newtown Kitty was not allowed to plead since the charge is indictable. His attorney told the court that the girl is Watson's stepdaughter, adding that her mother abandoned her, leaving the child in his care since she was 2 years old. The counsel also told the court that he was made to understand that it was the girl's grandfather who had intercourse with her. The matter continues on January 8, 2009. Consumer goods, the cost of cooking gas, greens and vegetables are some of the prices reduced within the last weeks, and Minister of Tourism, Industry and Commerce, Maniram Prasad, says he fears consumers are unable to benefit from the decline in prices due to the unscrupulous persons unwilling to lower their prices. Nicole Telford has more.
Minister of Tourism, Industry and Commerce Maniram Prasad has said that government has kept its promises to lower the impact of escalating cost of living by helping to reduce taxes on consumer items. As a result, prices on some consumer items and services have decreased.
We had meetings with the minibus associations and they agreed to lower the fare. The problem with that is that whilst the established minibus associations made the agreement and most of the fares were lowered, there were still some people out there who were charging the old fare, particularly if you give them, if you have to give back change.
The minister said that with a drop in both cooking gas and fuel prices, it was hoped that some business owners would be reasonable and lower their prices. In some cases, this was not to be.
I think Guyana is one of the few countries in this region where you have prices coming down, and we are monitoring it effectively. Some of our neighbors in the CARICOM countries can get the people to reduce the prices.
The minister added that the price for flour decreased following a meeting with Namilco.
In Guyana, the prices have come down, and we have reduced the prices significantly so that the consumers can benefit. All this savings must pass on to the consumers and the consuming public.
The minister says consumers should by now be reaping the benefits of the decrease in prices countrywide. He has since vowed to ensure this is done. Nicole Telford, NCN 6 o'clock news.
17 successful surgeries for clubbed feet and bowed legs were completed at the Georgetown Public Hospital by a U.S. medical team specializing in treatment of children with lower extremity problems. Chief of Orthopedic Surgery, Dr. Claude Scott, says the surgeries would have cost at least $5,000 US overseas. Monica Jones filed that report.
9 members of Health and Education Relief for Guyana have been performing surgeries here over the past few days. During a press conference, the medical team says they have concluded the final 2 operations. Chief of Orthopedic Surgery Dr. Claude Scott says the majority of the surgeries were for club feet, noting some extreme cases could not have been operated on due to their short visit.
We have seen some difficult cases, but we're not turning them away because we cannot manage them. It's a matter of time, getting the time down to do these cases. A lot of them are difficult cases that take a bit longer to complete. And if we had another week or so, I'm sure we could tackle a lot of those cases. But we have deferred some of them for next year when we come again.
Dr. Scott noted that it would take the patients 2 to 3 months before they can walk without a cast. The medical team indicated that they have offered continuous training to doctors at the Georgetown Public Hospital to deal with such cases. GPHC CEO Michael Kahn says this is part of their capacity building.
I can say confidentially that when they were here the last time, they trained 2 of our residents, namely Dr. Kahn and Dr. Watson, and they themselves did some clubfoot, and all indications are those surgeries were successful.
General Surgeon Dr. John Mitchell of the U.S.-based medical organization specializing in pediatric care says instead of traveling overseas, it is more cost-effective to do the surgeries right here in Guyana. Over the past 3 years, the team performed surgeries on 50 persons, 35 of whom were children. Club feet is a common birth defect occurring in about 1 in every 1,000 live births. Onika Jones, this is Clock News.